TARGT gene therapy platform for correction of anemia in end-stage renal disease. Gene therapy is an experimental technique that uses genes to treat or prevent disease. In the future, this technique may allow doctors to treat a disorder by inserting a gene into patient cells instead of using drugs or surgery. The technique remains risky and is still under study to make sure that it will be safe and effective.
Gene therapy has been studied as a potential treatment for genetic disease since the 1980s. The goal of gene therapy is to help correct the genetic disease by providing a functioning copy of the gene to make up for the genetic defect. In the laboratory, a functioning copy of the gene is packaged into a lentiviral vector. This is a modified virus that acts as a transport vehicle for the functioning gene. The lentiviral vector delivers the functioning copy of the gene into stem cells taken from the patient. The gene is then inserted into the DNA of these cells. In recent years, scientists have made improvements in these vectors and continue to study gene therapy as a treatment for many different diseases, including cancers, blood diseases, central nervous system disorders, and immune system diseases. More than 1,800 clinical trials have been conducted using different types of gene therapy in various diseases.
Anemia in patients with end-stage renal disease who are undergoing hemodialysis is caused in part by a reduction in or absence of secretion of endogenous erythropoietin.
Cheryl goes to dialysis 3 days a week. Lately, she's been feeling weak, tired, dizzy, cold, and out of breath. At first, she was unsure of the cause of these symptoms. Luckily, she came across the Doctor Conversation Guide for Anemia on kidneyfund.org and talked to her doctor about her symptoms. Cheryl's doctor explained that the majority of patients on dialysis have anemia for a variety of reasons. Ultimately, it is caused by not having enough red blood cells in your body. Cheryl's doctor was happy to share several treatment options and recommend other ways to improve her anemia so that Cheryl can feel like herself again. Visit kidneyfund.org/anemia-ESRD, download our free Doctor Conversation Guide, and talk with your doctor or another member of your healthcare team to find out more about your anemia symptoms and treatment options.
About 3.5 million people in the United States have anemia, making it one of the most common blood disorders. But what exactly is it?
Anemia is a decrease in red blood cells circulating through the blood system. It can become a problem because the red blood cells actually bind to oxygen.
Fewer red blood cells to carry oxygen around your body means less of the fuel that your cells and organs need to live. Anemia can be caused by several different things, but one of the most common causes is iron or vitamin B12 deficiency.
We find that a lot of times in patients who are vegetarians.
Another more serious cause, internal bleeding.
So for instance, if a patient has blood loss, maybe they may come in complaining of GI bleed. Young patients who still have menstrual cycles, they have fibroids, they can also have it. Patients who had surgery or some type of trauma can have blood loss.
The symptoms in either case are similar.
Concentration can be a problem, fatigue, lightheadedness, dizziness. Sometimes you can look into your eyes and go, oh, they look a little pale today.
And the treatment depends on the cause.
Patients have B12 deficiencies or iron deficiencies, then we can replace them with oral iron or we can give IV iron. If a patient has blood loss and they're complaining of lightheadedness and dizziness, sometimes they may need to be admitted and subsequently we'll give them transfusions.
If you're concerned about anemia, Moncrief says make sure you see your doctor regularly.
Most of us probably are fatigued, but if you just don't recover, if you're resting well and your sleep is good and you're still complaining of feeling fatigue, then you would probably want to be evaluated.
And if you have symptoms like fatigue that just won't go away, she says don't hesitate to make an appointment. Adam McCoy, CNN.
The vocations in medicine. Transduced autologous restorative gene therapy (TARGT), a new autologous protein delivery platform designed to provide sustained secretion of proteins, such as recombinant human erythropoietin, uses a small autologous dermal explant or explants in which several biopsy samples of a given patient's dermis are transduced ex vivo with the use of a helper-dependent adenovirus system that is engineered to carry a gene, in this case EPO, which encodes the human erythropoietin protein.
"15 years ago, I was referred a family from western North Carolina that suffered from a really devastating kidney disease. The disease was called familial juvenile hyperuricemic nephropathy. This disease was autosomal dominant inheritance, which meant that 50% of children of an affected parent would be affected. Family members would suffer from gout in their teenage years, and then they would develop progressive kidney failure and require dialysis or kidney transplantation anywhere between their 30s and their 50s. I was fortunate to work with many excellent people at Wake Forest, including doctors Tom and Suzanne Hart, who were a genetics team here, and we worked together to identify the cause of the kidney disease, which was a mutation in a protein called Tam-Horsfeld protein. Tam-Horsfeld protein is the most common protein excreted in the urine, but no one really knew what it did. And when we were able to identify this mutation, we not only learned a lot about this protein, but we were also able to identify other families with the disease. Over time, we referred about 300 different families that suffered from this or a similar condition. And we started studying really all inherited kidney diseases that are uncommon and for which a genetic cause is not known. We identified about 80 families that had mutations in this Tam-Horsfeld or uromodulin protein. And then working with a Dr. Stanislav Kamach in the Czech Republic, we were able to identify families that also suffered from mutations in renin, which were really interesting. These families suffer from anemia in childhood and progressive kidney disease and mild hyperkalemia and mild low blood pressures. More recently, we're able to identify mutations in another gene called mucoprotein 1 as a cause of inherited kidney disease. Again, autosomal dominant interstitial kidney disease, but this condition is not usually associated with gout. Once we know the cause of the disease, we can start thinking about treatments. For patients with the renin mutations, for example, we already have a treatment that we can use to help these patients. The goal of our research is always treatment. We want to find a treatment for these diseases. I'm a clinical doctor first, and when I see these families and all the suffering that they've been through, what we want to do is reach out and help them with an effective therapy. And so we really are not going to stop with our research until we develop such treatments.
The pros and cons. The pros: there were no serious adverse events related to TARGT and no signs on either histologic sections of TARGTs excised from patients or assays of anti-erythropoietin antibodies of immunogenicity to either TARGT or the erythropoietin secreted from the TARGT. The cons: this early study does not allow us to assess the risk or benefit of TARGT as compared with administration of recombinant erythropoietin injections. Such an assessment would require a prospective randomized trial. The issue apply in Ecuador. About genetic therapy, Ecuador is one of the few countries in Latin America where the government and the public health system do not count with genetic services in their hospitals. The World Health Organization recommends the presence of a geneticist for each 100,000 inhabitants in Latin America, which means Ecuador needs 15. We currently have 10. In the conclusions from the study, all patients who underwent TARGT implantation had an initial increase in plasma levels of erythropoietin, and plasma levels of hemoglobin remained above or within the desired range for most patients. The plasma levels of erythropoietin remain stable within the physiologic range.
And joining us here in the studio to talk a little more about the promise and potential dangers of gene therapy is Wolfgang Uckert. He is the president of the German Society for Gene Therapy. Thank you so much for being with us today. Now, the idea of gene therapy has been around for decades, but it's only seen limited success. Why is that?
Yeah, I think one of the problems was the transfer vector that is used to bring a new gene into a cell. So these vectors at the beginning were not really safe.
All right, what is the risk then associated with that?
The risk is that they integrate in our genome at the wrong place, and then we have side effects, and the side effects can be other diseases like leukemia, for instance.
Okay, that's a pretty heavy side effect. What can be done to minimize the risks or these side effects?
Yeah, this has already started years ago to improve the vectors. Now we have a new generation of vectors that are really safe because they can integrate in a certain point of the genome at specific sequences. And we have safety modules that are included in the vector and in the gene-modified cells, and we simply can switch off the vector and can eliminate the cell.
All right, is this leading to greater approval then of gene therapy?
Yeah, I think this will that improves gene therapy very much.
All right, let's talk about some of the ethical issues surrounding gene therapy. What are they?
Yeah, the ethical issues are that I think one has to select very well the disease which one wants to treat, because this is a three-component system. You have to manipulate a cell, you have a gene that you have to transport into the cell, and you have to make a vector choice. And this has to be well designed.
All right. Well, having said that, then, where does gene therapy look the most promising in curing which diseases specifically?
So we have seen this year, these are monogenetic diseases, meaning that only one gene has to be corrected. This is relatively simple, I would say. It's more challenging if we go to cancer, because cancer is a multifactorial disease, and there are many genes are included, and we have to correct each individual effect or each individual gene.
Okay. Now, we asked for some commentary on our Facebook page, and Alaku Alambugu says he thinks that gene therapy is okay as long as it can be used for therapeutic purposes and nothing else. But could gene therapy technically be used to enhance certain features like our looks or our intelligence?
Yeah, I mean, there is a little danger because we have increasing knowledge, growing knowledge, how things are organized in our body, what are the sequences, and one cannot completely exclude that that can happen.
All right. Well, back to the ethical issue, you know, that is a definite question there. And finally, what does the future for gene therapy look like?
I'm quite optimistic. I think that in a decade or in two, that many diseases will be cured by gene therapy.
So it's a very positive outlook that you're giving us.
Yes.
All right. Well, we thank you very much for this discussion today, Wolfgang Uckert.